Hello, hi, it's Dr. Erica Onagbola, pharmd, pharmacist. I've been a pharmacist for close to 10 years now, and I am uh, a content creator for YouTube, and I have a website, themillenniumpharmacy.com. So please visit all of my other platforms, TikTok and Twitter as well. Thank you for joining me. This is Dr. Erica. I'm going to talk about fluid requirements, whether to increase or decrease fluids in certain situations. There are some situations where increasing fluid can be fatal. There are some situations where decreasing fluids can also be the same. So we want to make sure that we are doing our best to make sure that we are adequately taking in and decreasing as required or as needed. So number one, when there's extra fluid in the body, you want to decrease the amount of fluids, especially the amount of salts in the fluid, because water tends to follow salt, like your sodium chloride, for example. So when there's heart failure, kidney failure, edema in the lower extremities of the leg, which is indicative of heart failure and also indicative of kidney failure, we want to reduce the amount of fluid intake and also the amount of salt intake as well. That could be heart failure types 1 through 4, also kidney failure, or kidney disease 1 through 4 as well. Now, also patients who have uh, diarrhea, patients who have experienced GI upset causing diarrhea, you want to increase your fluid intake, increase the amount of electrolytes. Usually you get those through the electrolytes, such as your Gatorade, your Pedialyte. Those type products have not only fluid, but also electrolyte replacement. So again, diarrhea is a need for increase in fluid intake. Okay, so also nausea and vomiting. When vomiting has subsided, then fluid intake can be rendered and can be ingested. So it's best to take a fluid after vomiting as well, as long as the fluid can be maintained. Also, in cases where there is increased urination, such as with diabetes or hypoglycemia or hyperglycemia, there may be an increase in urination. So patients do want to consider utilizing extra fluid during that particular time. And also, patients who do a lot of exercising, a lot of sweating, a lot of getting out into the sunlight, those particular populations should also increase fluid intake to make sure that they are not becoming dehydrated. Okay. Also, elderly patients should also increase their fluid intake as well to be sure that they're not being or suffering from dehydration. The skin during the years of uh, geriatrics, the skin usually becomes drier and more chapped, and so fluid is lost. And so when fluid is lost, then it's required to drink more water or have a better intake of fluid levels. It's suggested to drink 6 to 8 ounces of water in 24-hour period. Again, that's 6 to 8 hours or 6 to 8 glasses of water during a 24-hour period. Also, patients who have hyperthyroidism should also increase their fluid intake. Also, patients who are going through fever or high temperatures should also increase their fluid as well. And that'll also help bring down the fever as well. And also, patients who are going through a surgery or through a drainage, fistula drainage, they should also increase their fluid intake as well. Patients who have diabetes insipidus should also increase their fluid intake. Now, patients who should decrease their fluids are patients, again, who have kidney failure, also patients who have heart failure. And again, those patients who have fluid overload or edema on the lower extremities, whether it be the ankle or the feet, also the lower legs as well. Patients who are in high humidity climates should also reduce the amount of fluid intake. And patients who have a decreased urinary output or have an adjustment in their creatinine clearance should also reduce fluids. Okay, there are other cases that I won't go over. Patients who are taking particular medications should also increase their fluid intake, such as those who are taking Bactrim, those who are taking medications that treat urinary tract infections. Patients who are taking certain antibiotics should also increase their fluid intake when taking medications, because we want to flush the system, make sure the medications gets to its location of action. Okay. Also, patients who have a fluid overload can be flushed, uh, can have a system flushing. So do avoid fluid intake. Those particular patients, again, require a fluid flushing when there is a fluid overload. So we don't want to continue to add on fluids. Okay. I recommend fluid intake also in pediatric patients as well as geriatric patients. I mentioned earlier, pediatric patients are growing and are steadily growing. So fluid intake as well as proper nutrition is recommended. Okay, but fluid intake is very important in all stages of life. It is the fundamental element of or fundamental chemical of our being and also our living. Okay, and organ functioning properly as well. Okay, so when drinking sodas, it's best to utilize increased water or fluid intake post consumption of sodas as well to flush and cleanse the body and cleanse the kidneys as well. So do be aware of that also. I want to make mention about Pedialytes and electrolytes uh, that are over the counter. There's also a solution that is very new on the market called Liquid IV that I recommend. Liquid IV is another product that I recommend. It's like a IV, but it's through the oral route, and it's very much so appropriate as well. And I do recommend it. Liquid IV as well. Gatorade and Pedialyte. There are also other products that are in the same category that are on the market that may be beneficial to you as well. So do check those out. I have personally worked in pharmacy for close to 10 years as a pharmacist, registered pharmacist. I work for myself currently as a pharmd, and I have seeing patients come in to purchase different products for electrolyte replacement, patients who experience a certain disease states that require fluid intake post post diseases such as seizures. Patients who are dealing with seizures should also increase fluid and electrolyte intake post episodes such as epilepsy. Those particular populations, again, should take in more fluids post episodes to replace electrolytes and losses. So do remember that if you're an epileptic patient or know someone who is. Okay, so also I want to recommend that patients maintain a 6 to 8 bottles of 8 ounces of water in a 24-hour period to increase fluids, increase energy, and also to increase functioning of organ systems and cellular systems. Okay, so that is what I have for this particular episode. Thank you for joining me on this video. Please like, share, and subscribe. If you have any questions or comments, please let me know. Any topic suggestions, please let me know as well. I am also available on TikTok and Twitter, and also themillenniumpharmacy.com. So please join me on all platforms, and please watch all videos that pertain to you and share those videos as well. Thank you for joining me. I'm Dr. Erica. Have a great day.